let's have a class, and we will first of all do some of the review. Okay, so the plan will be this Thursday, Dr. Nettie Fresher, her office is just beside me. She will give a guest speaker, talk about lactic acid, bacteria, yogurt, from the nutrition standpoint, talk about the microorganism. So please attend, and we also offer like 3 points attendance bonus points for the guest speaker. The reason is university required us to have a guest speaker, then we can do a teaching innovation. That is required, so that's why I have this couple of guest speakers. Next week, Tuesday, which is March 11th, right here, we'll have our second exam. Okay, second exam is basically focused on the disease, which means the bacteria and correlated with the disease. So we gave you some of the practice questions, and I'm gonna go over these. Then we'll give you the idea what they're gonna be looks like. Now, of course, it's open book, so you have to remember, but something we need to emphasize. So let's give you an idea what it looks like. First of all, please do not forget, we have the after class reading. Right here, there is a 3. So please definitely print it out or download on your computer during the exam. You should use it. Don't forget about these, because some answer you're gonna be here. Now, the review question, what I go over today, absolutely you should take a look. You can't forget about that, okay? Otherwise, we won't spend time here. I mean, so that's something I want to emphasize. Okay, let's look at these questions. So this is John, an English instructor at the university, received a call from the adult daycare where his 74-year-old mother was staying. She was experiencing chest pain, chill, and fever. When he arrived at the daycare, she seemed to be short of breath, and the cough she had that morning had worsened and become productive. Okay, coughing with sputum. The local hospital prepared a sputum sample which grown blood agar and chocolate agar have alpha hemolytic zone. The gram stem reviewed numerous white blood cells and the gram-positive diprococcyl that catalyst tested negative. And the optical sustainability test was conducted, it was sensitive to it. So, which bacteria it is? So at the beginning, I'll give you those bacteria names, then you pick from there. Okay, so when you look at this is a gram-positive diprococcyl. That gives you major information. And we also see this is alpha hemolytic. So, gram-positive diprococcyl. Okay, catalase test negative. And what else? Alpha hemolytic. When we do these things, catalase test can differentiate streptococcus versus staphylococcus. Streptococcus is negative, staphylococcus is positive. And we say this is no bubble, and this is bubble. And the gram-positive diprococcyl. In the class, we only talk about diprococcyl is 2. It's Streptococcus pneumoniae and the Neisseria. Gonorrhea or Neisseria meningitis. Is that right? But those are gram-negative. Gram-positive diprococcyl, obviously, here, Streptococcus pneumoniae. And you look at all these symptoms. It is ammonia, is that right? That's what we should do, okay? So that's the first question. Now, how are you going to go review? Then go back and look at your slides. The slides have this one. So the idea is that when you do this question, you can print it out and stick onto the slides. Or you have your review material on the computer, print this out, attach to the side of your slides. So when the exam have the similar question, then you can do it. Okay? Second one. A mother brought her 4-year-old boy to the regional hospital. The boy was complaining of a headache. Here are the key things. Stiff neck. Stiff neck is important. Tough neck and a sore throat. The boy could not look at the lights, complaining it hurt to see. What this means? That means photophobia, which means scared to the light. So somebody have a tough neck. Somebody had a scare to the light. What this tells you? Most likely, meningitis. Is that right? Most likely. Then you go to see. The boy had a fever of 103 degrees Fahrenheit, appeared sleepy. Oh, lethargy, what we say. Chest examination and the radiograph were normal, but because of declining mental status and history of headache and photophobia, a lumbar puncture was done when showed 32 white blood cell. Okay, this is also the key. A gram stem of his cerebral spinal fluid was performed, and Arabic culture onto blood and chocolate agar. Find it's only grow on chocolate agar. What this means? And we mentioned you have a makanki agar. You have chocolate agar. And then you have a blood agar. This is the 3 major agar in clinical area. If the bacteria doesn't grow here, but grow here, what is called? It's a fastidious bacteria. Okay, these are the information. And then the patient history was significant. He had not received any childhood vaccination. And the bacteria run XV factor looks like this. Then which one? What are the bacteria here cause meningitis? And this typically is seen is a kids. Is that right? Kid meningitis. And it is a fastidious bacteria need XV factor. So what's that? Haemophilus influenza. So some people say, I don't know, I forgot about it. Don't worry. So it's open book. That's why always open book is nice. So you go back to see the slides. Is that XV factor is on the top? Chocolate agar? And this information tells you what meningitis looks like. So that's a very important information, this couple of these slides. So what you're going to study, you don't have to remember, take just 2 minutes. On the side of your slides, clicking the case study and meningitis. These are a couple of slides you can review. You can do an organization by yourself before you come in next week Tuesday. Then it's more easy for you to do the questions. Okay? So sometimes why I like to do this open book, because that tests you, not a memorization, tests your organization after class. How about that? So that's why it's a good training, you know. Question number 3. On Monday, January 29th, a 27-year-old female office assistant experienced a sudden dizzy while at work. The lady was carried to a co-worker's car and began to vomiting, complaining of a severe headache, muscle aches and nausea. The lady was taken to the hospital where her condition worsened. She claimed she had not been feeling very well all morning and presented a temperature of 103 degrees Fahrenheit. This is important. She developed a rash and experienced a sudden drop in the blood pressure, low blood pressure. Blood and the CSF, cerebrospinal fluid, was negative of sepsis and bacterial meningitis. So it's not meningitis. It's not sepsis, which means no blood, no bacteria in the blood. Her history was significant in that she was experiencing a new contractive sponge that has not been removed since the previous evening during the period of time. What organism is most likely? So you may get confused. And I tell you, that's a terrible stuff. Is that right? Riley tampon is a highly absorbent tampon the woman used in period of time in 1970. Makes the vagina tract is very dry, so normal bacteria, or we say beneficial bacteria like lactic acid, is completely died, and the Staphylococcus aureus is dominant. Then have shock syndrome. What means shock? Low blood pressure. And look at here. Using super absorbent tampons. Low blood pressure, fever. So what is the answer here? Staphylococcus aureus. That's why you should do Staphylococcus aureus. Now do the same thing. This question, cut, paste at the back with that horrible tampon. Then you know the story behind it. Okay, next one. A gram-positive occurrence was isolated from a 37-year-old female urinary tract infection, UTI, which stands for urinary tract infection. Laboratory tests indicate the organism grew on blood agar with no hemolytic zone, was catalyst test negative, serological belonging to Rebecca Lansfield group D. Okay, that is simple. Remember we talked about the Rebecca Lansfield group? What we have? Group A, Streptococcus pyogenes. Group B, Streptococcus agalactia. Group D, enterofacilis. So which one? Group D. This one we don't have a slides, but I write on the blackboard, so use this story to do the review, okay? Next one. A 22-year-old sexual active female comes into the student health clinic complaining of painful and frequent urination. The terminology here we call it dysuria, which means usually is equals to urinary tract infection symptoms, which means difficult to pee. The technician spun down her urine for microscope observation and find gram-positive coccale in grape-like cluster. Further testing revealed the organism was catalyst test positive and resistant to novel biopsy. Okay, this one is sexual active female. Is gram-positive coccale in grape-like cluster. What that tells you, it's very possible one of the Staphylococcus. Okay, which one then? we go back to the slides. Staphylococcus we are talking about here. Staphylococcus aureus, Staphylococcus epidermis. Then we talk about the story, and the joke is Staphylococcus saprophyticus, because a honeymoon bacteria related to sexual activity of women. Therefore, where is the answer? Well, go all the way to the top. Staphylococcus saprophyticus. Is that right? That's the answer. So when you study Staphylococcus, cut, paste there. So that's a strategy how you're going to review. And it's give you easy life. You don't have to remember. My major students have to remember all these things. Okay, next one. 20-year-old pregnant female elected to have home birth using a midwife. Oh, that's delivery at home. She chose to have little medical intervention, delivered a healthy 7-pound baby boy. On day 5 of postnatal, her baby was experiencing tremors, vomiting, and tachycardia, abnormal rapid beating of the heart. She refused to breastfeed and had a fever of 102 degrees Fahrenheit. His urine, cerebral spinal fluid, and the blood were cultured. The blood culture and the CSF came back positive for gram-positive, catalase test negative, beta hemolytic cocktail. Considering the age of the patient, which patch is most likely? And it's resistant to basic tracing. So first of all, you need to know, newborn baby usually do not have symptoms in the first 100 days because they get immune from the mother. But this baby has. So what kind of thing did this lady didn't do? Maybe not doing a screening test at 35 years old, 35 weeks of pregnancy. And then what is this patient looks like? It's gram-positive, catalase test negative, and beta hemolytic. Beta hemolytic, we'll talk about two things. What are the two bacteria beta hemolytic? Streptococcus pyogenes and the Streptococcus agalactium. And we said this is usually for a woman, 35-week pregnancy needs to do a screening test. Now, how we differentiate that? We're using an A-disc. We see some components is basic tracing. This is resistant, this is susceptible, and that is resistant. Okay, so what is the answer? Streptococcus agalactiae, group B Streptococcus. So the answer, Streptococcus agalactiae. Right here. Okay, very good. Next one. A Honduran mother and her 5-year-old boy crossed into U.S., stopped a freight train from Mexico, but were apprehended by U.S. immigrant authorities. And these questions are from CDC case. Okay, so I want to make sure there's no political behind it, because we talk about these things all the time. But these are the cases CDC listed as a case, so we use for study only. Okay, I have to be emphasized that. Shortly after being placed in immigration detention, the boy developed a sore throat, difficulty swallowing, and onset of neck swelling. Okay, that's very important. Then what is more important, the symptoms, a blackish gray membrane exudate was covering the volar and both tonsils. So tonsil area has a blackish gray membrane system. A throat swab was collected in the gram stain with gram-positive and a club-shaped arrangement. And the swab was then cultured on the blood agar with tellurite. The patient's history was significant. He did not receive childhood vaccination. What is this one? Neck swelling, blackish gray membrane in the tonsil area, and the bacteria is gram-positive club shape. So this is gram-positive club shape. What is that? And the vaccine could be prevented. That is our first pathogen we talk about at this section. Corynebacterial diphtheria. And the very important slide is right here. The two symptoms which is showing you in the picture. Swelling neck and the pseudomembrane greenish system at the tonsil area. That's diphtheria toxin. Now, which vaccine we can use? What it stands for? Diphtheria is D, Clostridium tetani is T, pertussis, Bordetella pertussis is P. So each stands for one bacteria. Okay, very good. So we talk about all these, you can do the review. Question number 8. From your pathogens list, which organism is most common surgery infection belongs to a group antibiotic resistant as a MRSA? We talk all the time. What is MRSA? Methicillin resistant. What is SA? Staphylococcus aureus. So the answer is quite simple. This is Staphylococcus aureus. So remember, Staphylococcus aureus, what do we are talking about? 3 things. Number 1, food intoxication, chicken salads. Number 2, MRSA, methicillin-resistant Staphylococcus aureus. And we call it a nosocomial infection because it's acquired from the hospital. What is number 3? It's a horrible tampon. Is that right? That's the 3 things we listed for Staphylococcus aureus. So you can even write a marker here. Have the notes, those are 3 things. And when you review, you bring it next Tuesday, it's easy to do the questions. Okay, question number 9. In Yavapai County, Arizona, that's a border. Okay, you should not, you know, you all come from here. Arizona is a border state. Okay, that means immigrant patient, and we assuming they not get vaccination yet. Okay, we are just assuming. A 13-year-old boy in the 8th grade was culturally confirmed positive for pertussis and had attended school during his illness. To identify others who may be infected, the probable clinical confirmation was established for the other students in the middle school. What was the criteria for clinical confirmation? What are you going to do? So what it looks like. These are, we're not going to do that. Rash on the neck, everybody. You can't say you have a rash on the neck or chest or arms and say that you have disease, is that right? No. So that all kind of things could happen. You could have pneumonia, you could have a lung cancer. Fever more than 101, everybody, every symptoms could have a fever. So which one? PCR for the nasopharyngeal specimen. Now, where are the answers, if you forgot? Did you see it? We make it bold, black, the keywords to let you understand and do the question. So review, click the case here. Okay, then you can well understand the pertussis, what we do the diagnose. The culture-based screening method for the prevention of systemic GBS. What is GBS? Group B Streptococcus agalactiae, acronym GBS. We usually don't say GAS and GDS. I don't know. Just in the clinical areas, they don't talk about that. GBS is a very standard name, Group B Streptococcus agalactiae. Recommends what? That's easy, we just mentioned. Screening pregnant woman for vagina or rectal GBS between 35 to 37 weeks of gestation. If it's tested positive, what we should do? Using antibiotics. Because otherwise the newborn baby will have a similar symptoms. Right here. So these two questions in this sheet, you can connect it. It's the same story, the same pathogen, different story, but it's connected. Okay? Approximately distance, you should insert a nasopharyngeal swab. Now I said that when we tested, it's interesting. What we should do? That's too long. Half the distance between earlobe and nose. How depth the nasopharyngeal swab should be inserted. Okay, so half the distance from nose to the earlobe. From the patient lists, next question. Which organisms are now considered a part of the United States recommended childhood immunization schedule? Okay, that's easy. We will take a look. Which one we have? Haemophilus influenza we have. Corynebacterial diphtheria we have. Bordetella pertussis we have. Streptococcus pneumoniae we should have. I don't think we have anyone for pyogenes. That's why, that's good. Is that right? Okay, next one. What etiological agent is responsible for childhood pharyngitis, tonsillitis, sinusitis, otitis, and suppurative skin infection, and with sequela, which means a disease followed by recovering the disease, such as acute rheumatic fever and glomerulonephritis. And I said that there is a one pathogen is very invasive. Even if you recover, you still may have symptoms. So many. Which one? We go back to see the slides. Circle right here. Glomerulonephritis and the rheumatic fever. So which one? Followed by a picture of strep throat. Which one? Streptococcus pyogenes. That's group A strep. And this is the number one excuse you don't attend in my class before COVID-19. I always make a joke. Here, GAS. So Streptococcus pyogenes, you should do. GAS, group A streptococcus, called strep throat, post-streptococcal disease, glomerulonephritis, and the rheumatic fever. And this is usually the kidney disease, this is a fever with joint pain, joint bone pain, okay? So that's the question how we're gonna do. Okay, so that's the first review question. If the exam questions are very similar, you can just read it using the similar, but at least go over these, okay? That's one thing. Let's look at another review question. Make sure to remind you, open book, you still need to at least to read it, get familiar with where it is before you come in. You cannot come in next Tuesday, doesn't have anything open. Like somebody who never taken this class, that will make it very difficult. The only thing open book you don't have to do is memorization, but you have to familiar with this material, at least you can find it. Okay, so that's the key. Here we have also some other case study. Let's go over these, okay, one by one. This is a pathogen list. This is a story. On June 22nd, 4 people who attend a cookout fundraiser for the local JC school hospitalized 24 hours with difficult swallowing. Okay. Difficult swallowing, double vision, and slurred speech. This is neurological symptoms. Many patrons of the event recall some level of mild stomach upset in the late evening of the event. It is significant to note that many of the dishes were prepared by local individuals from home canned foods. Okay, that's the keywords. Laboratory data from fruits served as event demonstrate gram-positive with subterminal endospore grow anaerobically, but not aerobically, in a canned yellow tomato dish. What is the pathogen for this? This should be simple. Yes?
It's botulism?
Yes, Clostridium botulism. Now, where it is? Okay, you say, I never attended the class, I forgot. Okay, we're assuming, okay. We're going to help you. We want everybody doing very well. Then we go here. That's botulism. Canned food on the top. That's exactly what happened. Yes?
Are any of the other bacteria like heavily associated with canned food? Or if I see canned food, can I just kind of assume?
Yes, correct. That's a good strategy. That's a good strategy for the exam, but don't assume it in the real life. This is going to have all kinds of Clostridium there. Okay, a good strategy to do the exam question. We are general education class. Don't do this if something happens in the real life. Tell people it's only Clostridium. Botulism could be other Clostridium. Okay, but the best answer here is Clostridium botulism. Yeah. So that's what we should have. Next one. On June 15th, a 70-year-old female was her normal stature of good health when he developed a fever for several days. She had no localized symptoms except for develop a large circular rash on her back. That's a big deal. Her history was notable. 3 weeks earlier, she had spent a weekend camping and bike on the Sorrel Trail in Mammoth Cave National Park. That was in Bowling Green, Kentucky. About like 6-7 hours from here, south from here. Her blood was cultured unsuccessfully, but presented an antibody titer 32 against the typical spiral sheet disease. That's a key. That is endemic for that region of the United States. The technician decided to view the blood specimen under dark field microscope. It just emphasizes it's a spiral sheets. What is the most probable etiological agent of this disease? These are the keywords. Then you say you don't know. Okay, let's go. Then let's see it. We have the slides right here. Which one have a rash? Yeah, Lyme disease. Now the question, which bacteria cause Lyme disease? Borrelia burgdorferi. That's called Lyme. So you can see, if you're going to remember it, is that hard? But if you find it, it's not difficult. Borrelia burgdorferi. Lyme disease. The key symptom is target rash. And it's a spiral sheet, so use dark field microscope. And this is connected to what we learned in the exam 1. In our second class, we talk about dark field microscope. You don't have to do this one yet, but I'll just talk about. During the month of June 2010, the Kentucky Warren County Health Department identified 31 persons who had diarrhea within 10 days of visiting a beef cattle operation in Warren County. The patients ranged in age from 6 to 10 years. Symptoms reported by the 21 patients included blood diarrhea, fever, and vomiting. 16 patients were hospitalized and 2 developed hemolytic uremic syndrome. It's a beef. All patients attended 3 elementary schools and that had visited the farm. Approximately 300 persons visited the farm during the month of June. Stool specimens were plated on macaque agar, suspicious. You see something on macaque agar, we learned already. It is lactose positive. Is that right? Lactose positive. So what is this one? We will talk in the exam 3, but this is a good case study to do the pre-review. It's E. coli 0157H7. And the typical symptoms is a hemolytic uremic syndrome. We call it HUS. Usually in the beef cattle, because that's a good reservoir for this horrible pathogen. And you hear about the E. coli 0157H7 all the time. There is a news said there is a beef company recorded by 500 pounds of the beef chunks or the ground beef, potential contamination with E. coli 0157H7. That's what's going to happen if you don't do the prevention. Okay? Next one. 60-year-old male was admitted to hospital. 5 days prostate surgery, complaining of dysuria. A qualitative quantitative urine culture was obtained and revealed E. coli in significant numbers. The physician placed the patient on a 7-day cephalexin. This is antibiotics. What do you mean 7-day course of cephalexin? That means very intensive to using antibiotics. Then you see the urinary tract infection improved, but the patient later experienced multiple watery loose stools, cramping, abdominal pain, dehydration. The physician ordered an AB test or stool sample, which returned positive. The patient was diagnosed with pseudomembrane colitis, unsuccessfully with typical antibiotic therapy. So what do? Sounds terrible. Have to do fecal transplant. Which one? Clostridium difficile. So where it is? Right here. Antibiotic-associated colitis. And we mentioned this is a patient who is using antibiotics intensively. So normal bacteria is down. Clostridium difficile dominant becomes pseudomembrane colitis. And the method's pretty much ironic. We use penicillin, let's say too frequent. So we have to change another penicillin. Is that right? We not use penicillin, we use vancomycin. Because one is attacking the amino acid links, and another one is attacking the cross links. And if it's not going to work, what we do? Fecal transplant. It sounds horrible, but the idea is put the normal bacteria back to the intestine. Okay, so that's a very good question, example questions for you to review. This guy sounds not very difficult. Blood agar plates can be used for growing the anaerobic bacterium that causes gas gangrene. That's easy. Which pathogen causes gas gangrene? And the organism was isolated in biobag anaerobic system and displayed a typical hemolytic response that is characteristics of disease. Look at here. What this means here? This is double beta hemolytic zone. It's like this, like that. So what's that? So pretty simple strategy, like you mentioned, she mentioned. What is that? Which one causes gas gangrene? If you don't know, then let's look at the slides. Go back here. Okay, that's gas gangrene. Clostridium malnecrosis. Clostridium perfringens. Okay, so these are the samples which is tells you how to do that. What is the answers for that, how we do. So these give you some of the idea what the question will be looks like. So hope it's gonna help you. So go back to review these each one by one, and we'll do the, sorry, this is already done. We're gonna see you on Tuesday to do the exam. Okay, we have a couple of minutes. We have 15 minutes left. We're going to talk about something. So we talk about DNA replication. So we're going to talk about transcription. And we mentioned about the DNA and RNA. So let's talk about that. After finish talking about transcription, we'll just let you go because I want you guys to do a good study. Okay. Thursday is a guest speaker. We'll let you relax a little bit. After that, because that's give you some of the general information, and then we will let you do the exams. So give you some extra time to do the preparation. Transcription. So let's go back to talk about this. DNA going through replication, then go to RNA, this process called transcription, and finally we'll go to protein, this process called translation. And this whole thing, we call it the central dogma. It's very easy. We finished talking about here. We're going to talk about transcription. The first thing I want to mention here is, what's the difference between transcription and translation? Transcription, it is still letters to letters. Translation is different. Is letters to chemicals, which means this is amino acids. Further become peptide and protein. That's the difference. So you can understand that, for example, I speak Chinese. The translation from English to Chinese, that is called translation. But if you're only still getting a stick around with English to English, then you can understand kind of like a transcription. But we have another words we call the paraphrase. That's what this means, okay? So transcription. Before we doing that, we want to give you a quiz. I have a double bonds of DNA running 3 opposite direction, 5' to 3'. 3' to 5'. Okay, I have ATGCAT. What's the sequencing of the second band? That's easy. Gene complementary policy. So will be TACGTA. Okay, what is the sequencing of this mRNA? That's called the transcription. The first one called the replication. This is called transcription. What is the sequencing? Exactly the same on the top. The only thing is, instead of you have thymine, I have uracil. So what happened? A, G, C, A. The only difference is this is U, this is U. Therefore, the DNA, this is called a coding strand. And the following one, we call it a template strand. And this is the mRNA going through transcription. Transcription need an enzyme, which is RNA polymerase. This is what it looks like. And the RNA polymerase is a hollow enzyme. Which means there are different components. Alpha, beta, beta prime, and omega. So what this means, there are 5 subunits. 2 of them are alpha, one is beta, another one is omega. But the more important for the RNA polymerase, there is a sigma factor. The sigma factor will help the DNA polymerase to find a very conservative sequence of the DNA we call promoter. So basically is that in this sequence, there is a chunk of something recognized by sigma factor. And the RNA polymerase could attach to it and start the transcription. And the transcription, the direction also 5.23. Now we mentioned about the DNA polymerase is created, discovered by Arthur Kornberg, win the Nobel Prize. And who is the person who find the RNA polymerase? Is Roger Kornberg, is Arthur Kornberg's son. He also won the Nobel Prize in 1996. But the RNA polymerase, the structure is more complicated. You look at that. So the research is still going on because the subunits of all kinds of things. So they're still going on to talk about that. But there is one